Hello, my name is Irene Goyes, and this is for pharmacology class with Professor Hunt. And in this week's assignment, we were asked to answer a series of questions. And so I will go ahead and just start by answering question number one. So question number one wants us to answer based on your first impressions of this patient's action and appearance. What do you suspect she is suffering from? So I think number one, that she's homeless, being that she smells like urine, and she's an alcoholic, uh, and maybe she's suffering from some mental health issues as well. So according to Moini, which is our textbook for this class, he refers to symptoms that can include confusion, disorientation, and agitation in regards to alcoholism. So question number two, it asks, what short and long-term health risks would you suspect this patient faces? Well, short term, it did say in the scenario that she scraped her arm and face. And so those are something that can be short term, can be fixed. As far as long term and short term, depending on how bad the alcoholism is and if she's suffering from DTs, which is delirium tremens, then that could be a little bit more serious in terms of treating her. Also, the damage that the alcohol has done to her. There could be liver damage, which may lead to cirrhosis of the liver. So just depending on those extremes, depending on how long-term the treatment would be for this patient. Then for question number three, why do you think the patient's hands are shaking? And what do you think causes her confusion and combativeness? Well, going back to what I had stated from Moini in the textbook, DTs, delirium tremens, can cause confusion and agitation, and also can cause shaking in the hands. You'll see that with a lot of alcohol withdrawal patients, because they haven't had alcohol maybe for some time, and so their body is starting to withdraw. And along with the agitation, she's confused. She doesn't know where she's at. She's, in a ambulance. So that could have maybe caused the combativeness. So definitely, I think that's due to the detox from ETOH. So finally, with question number four, what assessments do you think are needed for this patient? She needs several assessments, starting with the scrape on her arm and face that we spoke about in number three, or number two, I'm sorry. And so she definitely needs to get treated for that. Also, for ETOH withdrawal, definitely needs an assessment for that to see what type of treatment she needs, and also for her delirium tremens DTs. Also, I think a psych eval would be needed here. I think it wouldn't hurt. I think she needs to be assessed for that. Um, and then also she's homeless, so maybe a social worker can get involved and figure out what the next steps are for this patient. So finally, with the research question, it's asking about mental illness management and both pharmacological and therapeutic methods for treatment. And it's asking for me to summarize how this is managed along with the support of insurance. So going first along with pharmacological and therapeutic methods for treatment. Well, first and foremost, it's important to see a doctor. You need to get formally diagnosed with the mental illness. And then depending on the severity of the mental illness depends on whether or not you'll need an actual prescription. For example, there's anti-anxiety medication, antidepressants, antipsychotics, but say if you're suffering from depression, and you just need somebody to talk to, talking to a therapist or getting counseling is also a therapeutic method. Now, as far as the supportive insurance, is it sufficient? It wasn't until 2014 that was mandated that mental health and substance abuse be under private insurances. And from what I found in my research, Medicare does cover. However, it has to be Medicare will cover drug rehab if the doctor states it's medically necessary. So the problem I see there is if sometimes if if you're older and you don't and you're on drugs, you might not have a regular family physician to see to be able to deem you medically necessary for drug rehab. So that might be a hurdle to cross over. Also, with Medicare, you have to be 65 or older. For younger people can be on Medicare. They just have to have disabilities or end-stage renal disease, or anybody with end-stage renal disease can be qualified for Medicare. There's two parts to Medicare, Part A and Part B. Part A would be the hospital part. So if you were feeling suicidal or homicidal and went into a hospital and needed to be on a 72-hour watch, Medicare A would cover that part. Medicare Part B would cover the outside part, like, for example, if you needed to see a therapist or follow up with your doctors, get blood drawn, that's the part that would cover that. And it seems pretty sufficient. And as far as private insurance, it seems pretty fair, being that it's the same as if you were to have your appendix out or some type of surgery that you were needed. It covers the same amount. So I think that's sufficient enough. I think it's fair enough. The only thing is that if you do have someone that comes in that's homeless um, and is on drugs, and you have a family member and you just can't get them to see a doctor, that might be difficult. But as far as that one thing, I would change that, and so that goes into the next question: what could make it better? So that would make it better. I think that would be hard. I don't know what I would do or how I would change it. What I would suggest, but I think that it would need to be relooked at. Um, just to make sure that everybody has a fair chance of getting some type of help, whether it's mental health or drugs, substance abuse issues. Thank you.